What is prior authorization in healthcare? Why do insurance companies require prior authorization cost control? They want to verify that expensive treatments, medications, or procedures are medically necessary before approving payment, appropriate care management. They review if the proposed treatment follows established medical guidelines and best practices. Prevention of unnecessary services. They aim to reduce potentially wasteful or redundant procedures. Specialist referral management. They verify that specialist care is necessary when primary care physicians make referrals. Medication management. They control access to expensive drugs or medications with potential for misuse. From a patient perspective, prior authorization can be frustrating as it may delay care and create administrative burden for healthcare providers. Doctors and medical staff often need to submit detailed documentation justifying why a specific treatment is necessary for a patient's condition. If you're dealing with a prior authorization issue currently, you might ask your doctor's office if they have staff dedicated to handling these requests, as they're experienced in navigating the process efficiently. Profit motive. Ultimately, the motive behind insurance companies insisting prior authorization is profit. The primary intention behind prior authorization is indeed financial. It helps insurance companies control costs and maintain profitability. While insurance companies often frame prior authorization as a quality control measure, there are several profit-oriented motivations. Direct cost savings. By denying or delaying some treatments, insurers reduce their immediate expenditures. Administrative barriers. The complex process discourages both providers and patients from pursuing certain treatment. Time value of money. Delaying payment allows insurance companies to hold on to funds longer, steering toward preferred options. Directing patients to lower-cost alternatives or in-network providers that have negotiated favorable rates. Risk management. Limiting access to expensive treatments helps insurance companies maintain predictable financial outcomes. There's evidence supporting this view. A 2018 AMA survey found that 92% of physicians reported prior authorization delays negatively impacted patient clinical outcomes, while insurance companies saved money. Similarly, a 2021 Kaiser Family Foundation analysis showed that Medicare Advantage plans, which extensively use prior authorization, have higher profit margins than traditional Medicare. While insurance companies do have legitimate concerns about medical necessity and appropriateness of care, the design and implementation of prior authorization processes suggest profit maximization is a significant motivating factor. Is there any federal or state law limiting prior authorization? Congress has been working on legislation to address prior authorization issues, though no comprehensive federal law has fully passed yet. Here's the current status. The most significant legislation is the Improving Seniors' Timely Access to Care Act, which has had bipartisan support. This bill would reform prior authorization requirements under Medicare Advantage plans by creating an electronic prior authorization process requiring faster response times for authorization requests, establishing transparency in Medicare. Advantage prior authorization requirements, requiring regular reviews of items and services subject to prior authorization. This bill passed the House in 2022, but hasn't yet become law. It's been reintroduced in subsequent sessions. Some states have passed their own laws limiting prior authorization practices, including requirements for faster response times, restrictions on retroactive denials, mandates for electronic submission systems, exemptions for providers with high approval rates. If you're concerned about prior authorization practices, you might consider contacting your congressional representatives to express support for federal reform legislation. States against prior authorization. Several states have enacted laws to limit and regulate prior authorization practices. Here are some notable examples. California implemented laws requiring responses within 5 business days for non-urgent requests and 72 hours for urgent requests. Colorado passed legislation requiring streamlined electronic processes and transparency in criteria. Illinois enacted the Prior Authorization Reform Act, requiring quicker response times and prohibiting certain retroactive denials. Minnesota requires health plans to post their prior authorization requirements online and establish electronic systems. New York implemented comprehensive prior authorization reforms, including gold card programs that exempt providers with high approval rates. Texas established a gold card exemption program where physicians with 90% plus approval rates on certain services get automatic approvals. Ohio implemented standardized prior authorization forms and faster response time requirements. Michigan enacted legislation mandating electronic submission processes and transparency requirements. Virginia requires insurers to respond within set timeframes and maintain updated criteria. Washington implemented standardized processes and real-time decision-making requirements for certain services. These state-level reforms generally focus on several common elements: faster response times, electronic processing requirements, transparency in criteria, restrictions on retroactive denials, and exemptions for providers with consistent approval records. The specifics vary by state, so the actual implementation and effectiveness differ across jurisdictions. Thanks for watching. Please subscribe.